Welcome back to Northwest City Politics in the Know with Juanita. We're glad you're joining us again this week. We're always happy for people like you, people that are interested in what's happening in our Northwest cities. All of the CCX's viewing area. Because good government needs people that are interested and add their ideas to the city councils and the mayors and the staff. And we're happy that you're going to learn a little bit more about government. Now, each week we generally have someone from one of the 9 cities that bring us up to date on what's happening in their city and going to be in the future. But then from time to time we touch on things like the legislature. And I'm glad to welcome Representative Mike Freiberg.
Yep, glad to be back on the show. It's always a pleasure.
Right. We've had you lots of times before, so we're glad to have you back to kind of give us an idea of what you think might happen during this legislative session, which starts next week, I think, right?
Yep, just on Tuesday we'll get sworn in for another term.
Be ready to go. Why don't you give a little information to introduce yourself out to our wider audience, a little bit about your background and getting into the legislature.
Sure. Well, I grew up in Golden Valley. My parents moved there when I was 6 weeks old, so it's pretty much all I've ever known.
Right.
I went away to college, worked on the East Coast for a couple years, but came back to go to law school. And when I was in law school, I got elected to the city council in Golden Valley. I spent 9 years doing that and enjoyed it very much. But in 2012, an opportunity arose to run for the legislature. Decided to give that a chance. I felt, I'd been on the city council for 9 years at that point. I felt like I might, I knew the issues, felt like I had something to offer. I'm married. I have 2 kids, the kindergartner, third grader. They both go to Robbinsdale Spanish Immersion School in the Robbinsdale School District in New Hope. And, I feel like as a parent, I'm familiar with the public education system, and I've just enjoyed my service so far, both on the city council and in the legislature.
Now, each political party needs to kind of develop an agenda for the biennium that's just starting. What are some of the steps that your party has taken now in developing an agenda for what they want to accomplish?
Well, sure. During this past year, we created this process called the Minnesota Values Plan, where we held a series of meetings around the state. I went to a couple of them myself, just tried to bring people together, find out what issues are important to them, and those are sort of the issues we campaigned on and intend to govern on as well. And so it's not super surprising. I mean, what we heard from people around the state, but things like healthcare was a huge issue this past during the past election, and so making people are concerned about the price of their healthcare and ensuring that they have access to quality healthcare. I mean, we have healthcare that works for a lot of people very well in this country, but for some people, they're very worried about it.
Right. Oh, definitely.
So, job-related issues like paid family leave and earned sick time, child care options, education, ensuring everyone has a quality education, both at the K-12 level and then just don't come out of college burdened with unsustainable amounts of debt. Investing in transportation, I think, in reducing traffic bottlenecks, I think is a big concern of a lot of people. So just kind of bread and butter type issues, I think, are the issues that we heard probably the most from people as part of that process, and we went all over the state.
So a number of legislators went to various areas of the state. So you've got kind of a widespread viewpoint of where are people coming from?
Yes, absolutely. Yeah, and I was all over the state, both supporting candidates and also as part of this process, just to find out what issues people are concerned about. So,
did you see a big difference between different areas?
Yeah, I mean, if you're in, there are certain. Maybe the issues I'd say are kind of the same, are very similar. I mean, healthcare, education, transportation, education are issues I think all over the state. But there's maybe more of a focus on certain economic type issues as you get out to Greater Minnesota. So it's been an interesting process over the last year.
I would think so. Right. Now, one of the specific issues that they'll be dealing with would be transportation. Now, It's been brought up before, but it hasn't been kind of resolved because of a number of differences of opinion. Maybe you can give us a little background on what's happened up to this point, and then we can talk about what you think is going to be up and coming.
Sure. I mean, the last couple sessions, I don't feel like transportation's been a major priority,
Right.
and I think it needs to be. The bills, the transportation, we haven't had a government shutdown in the transportation
Right.
department or anything
Right.
like that, but the bills that we ultimately passed were really basic and didn't, provide the resources, I think, just to address some of the issues that we'll be facing in the coming decades with our transportation system, both road, whether you're talking about roads or the mass transit
Right.
system. So I think there is kind of an unmet need that's been building up over the last few years. The last kind of big investment we made in transportation was before I was in the legislature in
Yeah, that's a while,
2006, I think it was, when they overrode Governor Palente's veto to raise the gas tax that year. So, and it just the costs to our transportation system haven't kept up with inflation since then. So there's a huge amount of unmet need, I think, all over the state.
And what are the kind of the underlying issues, or why they're not coming to agreement? Because it's been over more than one session.
Honestly, it's
Right.
how are you going to get the revenue to address it? So, the raising the gas tax is certainly a controversial issue.
Right.
I think it needs to be on the table. I don't know if it's a perfect solution to our problems. I mean, cars are becoming more fuel efficient.
Right.
There are electric cars that use almost no
not
gas
at
at all.
right.
So, using that as a source to fund all the roads, bridges,
Right.
transit, buses, trains isn't necessarily a perfect solution, but it'll probably be part of the discussion. Maybe down the road there'll be some long-term way that legislators are able to find it to
Come together
address,
on,
to address like just the whether it's the mileage driven as opposed to just the amount of gas used, or what. But certainly, I think in our area in the suburbs, having more transit options is a huge deal. I feel like, my wife started riding the bus to work every day. She got a job in downtown Minneapolis, so where there's nowhere to park. So, and it feels like the bus system, at least until we can get the blue line through our area, which I strongly support doing. We need to invest in buses just to make sure that the entering suburbs that don't have the opt-outs are fully served by the
jobs,
the transit system. Because a lot of people don't have cars and depend on the buses. So
Well, and there's the whole issue of not much has been done for a long time, so you have things wearing out.
Yes,
or
absolutely.
potholes in the road or whatever. And so that's part of the impetus to get something done, but also with differences of opinion.
Yeah, no, absolutely. So it sounds like Governor Walz is very interested in this issue. He appointed the former Speaker of the House, Margaret Anderson Kelleher, as his Commissioner of Transportation. So, and she was actually the Speaker at the time they overrode the Governor Palente's veto. So I think it's an issue she's certainly very capable of handling, and I think we'll put a strong priority on making sure there's a long-term system in place.
Yeah, and then there's some talk of that there's not there's a need for balance between roads and transit and outstate and in-state, and can you just reflect a little bit on that?
Well, sure. I mean, any comprehensive transportation package is going to have to address the needs all over Minnesota.
Right.
I mean, what gets the assumption a lot of people have and that some legislators make is that in greater Minnesota that's only roads and bridges, but there are actually, there are transit systems in Rochester and Mankato and Duluth also, and St. Cloud, and those need to be supported as well. And so I think it's got to be a kind of a balance. It's got to be balanced around the state. It's got to be balanced by mode of transportation. And it's got to have there are pedestrians out there too. So people who bike to work, and so they
need to be considered.
They should be part of the equation, I think, as well.
So hopefully this will be a legislative session when they'll find a way to come to agreement, right?
Yeah, I hope so. I'm optimistic.
Okay, and another issue is education. Do you think educational issues will have a major part of this session or not? Because it definitely was something Governor Dayton felt strongly about.
Yeah, I think they will. Governor-elect Walz, he hasn't been sworn in yet. He's a teacher, so I think it's something that'll be very important to him as well. So, and whether that's early childhood education, I know that's certainly been a focus of Governor Dayton. I imagine it will continue to be one for Governor Walz. K-12 education or the higher education system, just students are coming out with way too much debt. I think so. When my party was in the majority in 2013 and 14, we did pass a tuition freeze at the public colleges and universities. I think we need to at least consider doing that again, if not actually start making a dent it's just the tuition levels have risen to an unsustainable amount for people.
Well, and the legislature has in the past funded both higher ed and K through 12 to a higher percentage than they do now.
Yeah, and that's true. And hasn't kept up to inflation. So I know one of the school boards association. I know one of the things they talk about is indexing the general education formula to inflation. That's certainly something I think that could be looked at. Special education costs, I think, are huge for school districts in this area.
And the federal government has never funded them to the level that they said they would.
Correct, yeah. And so I think the state can and should pick up some of the difference there, because it is a very it's a challenging aspect for local school districts who want to educate all of the students to figure out how to make it all work.
And then the school districts do put together their own legislative groups to come and talk to people like you, right?
Yep. Yeah, no, and I know I've met with the School Boards Association, the Robbinsdale School District. I mostly represent the Robbinsdale District. Has their annual legislative breakfast coming up. I think it's next week already. So, and they'll highlight their priorities, and it's kind of the issues they talked about. So whether it's funding the education, general education formula or special education. I know they're interested also in the state authorizing school districts to basically giving them the authority to renew operating referenda just by a vote of the school board rather than having to go to a vote of all the people. I know in Robbinsdale we had that went the wrong way, 10 years ago or something, which was a bad situation for the school district.
And other areas government don't have to do that.
Correct. Yeah,
and school districts too.
Yeah, and education is one thing that is spelled out specifically in the state constitution as a right for people to a uniform system of education is a right that people around the state have, and the way the system is right now, they're not treated uniformly. I think, which is potentially a problem with the state constitution.
Now, last year's legislature didn't get to working on a tax bill that would bring conformance for Minnesota's taxes with the federal ones. What's been happening on that, or what do you think will happen?
Yeah, for a while I thought it sounded like it might be possible for something to happen earlier in the session. The sense I have is that the Department of Revenue has been working to address this to make it as easy and straightforward as possible for people. With the federal tax bill passed last year, there were a lot of dramatic changes made. So I do think down the road it's something we need to make sure happens. The sense I have is that it may not be an issue where the Senate and the House are able to come to agreement on it. But also that it's possible passing something like that could just complicate things for people who are
in the
trying
middle,
in the middle
yeah.
of filing their taxes,
Right.
because the tax deadline for most people falls right in the middle of the
Right. But
legislative session
right.
too.
You'd still be in session, right?
Yeah.
And I'm sure it takes a while, even if you pass a bill, to get everything, all the written work and everything to conform to the bill, right?
Mhm.
So,
Yes, exactly. Yeah. So yeah, no, I can't say for certain how that one will
Well,
turn out,
yeah,
but I do feel like, again, the Department of Revenue has done a lot of work to make it as streamlined as possible for people to get their taxes done without too much trouble.
Right.
So hopefully we'll see. So
now, the budget debate is a primary part of the first biennium, and there's a projected, the last I saw in the paper the other day was a $1.5 billion surplus that could help with major cuts, but then you've got the whole federal Washington thing, and how is all that going to interact?
Yeah.
So what are your thoughts on it?
I think we'll be able to, make some investments. I certainly think education is a worthwhile one. The extent we can have a well-educated population here in Minnesota, I think will just help the state moving forward and continue how we've done historically.
Oh, definitely.
I think healthcare access is going to continue to be a really important discussion.
Oh, yes.
Making sure, whether it's allowing people to buy into the Minnesota Care program, which has been an important program for a lot of people. So I think that's something we need to be discussing. So
yeah, because both the money for Medicaid with that tax on, I'm not quite sure how that tax worked, but there was a tax that helped provide
the provider
that.
tax. Yeah, that's
plus the fact that getting people more care, like under Minnesota Care, both of those things are kind of going to go away unless the legislature does something.
Yeah,
right?
yeah. So I mean, it's definitely a lot better to be having these discussions when you have a surplus, as we do now. So, I mean, obviously there will be a lot of competing interests competing for a slice of the surplus.
Oh,
but,
yeah.
And I can't say for sure at this point how it will all work itself out, but I'm sure there'll be a lot of good discussions.
Yeah, and if people are interested, keep track of what's happening during the legislature.
Yep, absolutely.
What are your wishes in terms of what would pass in healthcare?
Well, yeah, I mentioned the Minnesota Care buy-in. I think that's an important discussion. I think there's some uncertainty right now about the Affordable Care Act. I know there was a judge that, federal district court judge that struck down the whole law. So, there are a lot of really important provisions in there. So, protecting people with pre-existing conditions, allowing people age 25 to stay on their parents' health care plan. So making sure women have access to all the care they need. So I think those will be part of the discussion, as well as just providing health care access. There's certain public health related measures that I've always kind of been interested in.
Oh yeah, because that kind of ties right into your vocation, right?
Yes. So I've carried a bill the last few years related to immunization policy and trying to make sure more people are vaccinating their children in Minnesota, because we saw with the measles outbreak a year or two ago that it is really important for people to get vaccinated. So that's something I'll continue to work on.
Yeah, and vaccination, you need enough of it to help from the spread of things, but with the access of people traveling nowadays, even more so.
Yeah, no, absolutely. It's called herd immunity.
Right.
I know just measles is the most commonly discussed one because it's so transmissible and contagious. So if something like 95% of the population, if less than that is covered, then it makes it much more likely that there might be an outbreak of a vaccine preventable disease like that. And I mean, as a whole, if you look at the vaccination rates of Minnesota as a whole, it's actually pretty good, but there are pockets of communities in Minnesota where it's not as high as it is statewide, and that's is partly why we saw the measles outbreak. It was primarily contained within the Somali American community. So So just making sure, providing culturally appropriate,
Right.
immunization materials to people to make sure that we can keep the immunization rates high and make it statewide and not
Right.
just in certain communities.
And with the legislature passed, and I don't know what kind of bill, but they passed so that they could provide more funding to healthcare companies so they keep the premiums low.
Oh yeah,
Maybe you can explain it better
sure.
than
Yeah,
I did.
it was called a reinsurance
Yeah.
plan.
Yeah.
I wasn't a huge fan of that approach.
Uh-huh.
It cost something like $500 million,
yeah.
which is
Yeah.
a huge amount of money, and it wasn't. To me, it seemed like something of a giveaway to
Yeah.
insurance companies, and not a sustainable one.
Right.
At that, so we had there was a bill to eliminate price gouging by pharmaceutical
Right.
companies. So, I think approaches like that are more have a better chance of being more sustainable in the
Sure.
long run, rather than just giving away $500 million to insurance companies without any guarantee that they will actually use that
Right,
money to
right.
help keep people's premiums at a low level. I don't think that was the best approach.
Right.
Yeah.
Yeah, and it was just a one-time thing.
Mm-hmm.
Are there any other health issues that you think people should be aware of that might be coming up for them to follow?
Yeah, I think tobacco use, I think, is always
right,
important, and
right.
e-cigarette use.
Right.
We've seen an explosion of, the overall smoking rates
Right.
for young people have been steadily going down, but now with e-cigarettes getting more popular, that
Right,
trend is,
right,
there's a
right.
danger it's
Definitely.
going to reverse itself. I don't know if you've heard of these products called Juul,
Right.
Juul.
Yes,
It's a kind of e-cigarette that looks more like
Yep.
a flash drive that students are actually using in their schools because they don't actually look like a conventional
Ooh,
cigarette.
and big one-page ads in the paper, too.
Yes, I know. It's really disturbing, and
Yeah.
the e-cigarette companies are using tactics similar to what the tobacco industry
Right.
was using for many years. So, whether it's increased education or raising the age to purchase these products from 18 to 21,
Oh, yeah.
or raising, and actually one of the areas the legislature cut taxes on tobacco products, which I was
Right.
not
That was
supportive
surprising.
of.
Right.
It just didn't seem like good health policy to me. Young people are particularly price sensitive, so
Right,
if you can
right.
keep the cost of tobacco products high, it actually, in addition to helping the state's revenue situation, it has a public health benefit to doing
right.
so.
And then the whole issue of opioids is a rising concern particularly from all the overdoses and things. How would you like to see this problem handled, or what do you think might happen in regards to this in the legislature?
Sure. I think, the opioid manufacturers have sort of had free reign to market their products and, used kind of questionable tactics to encourage doctors to prescribe them. So I think some of the responsibility needs to be on the manufacturers that helped create the problem. And in the past session, I think there was a opioid stewardship fee proposed. It was commonly called the penny a pill proposal. So it would basically be a fee or a tax, whatever you want to call it, of 1 penny on each of these opioid prescription pills. And it would go towards things like substance abuse prevention, training for law enforcement to deal with overdoses, and programs like that. So I think, but unfortunately, this was part of the governor's concerns with the omnibus bill, was that the bill didn't sufficiently tackle that problem. It just kind of kicked the can down the road, created some advisory commissions to study the problem. But we already know it's a problem. And there was, I think, a really an effective proposal put out there this past session. So I'm hoping the opioid stewardship fee or tax will be considered again during this upcoming session, because it's a huge problem in lots of communities all over the state.
And without a clear-cut answer about what to do, so you do have to try lots of different things to find out what might work, right?
Yeah, absolutely.
And we've just got a couple minutes. We'll touch on something that may or may not happen, but a lot of states have been legalizing the use of marijuana. What does the legislature, what have they talked about in regards to that, or what do you think?
Sure. I think it's going to be a discussion over the next couple years. Governor Dayton has, it's not solely a partisan issue. I mean, I would say for the most part, members of the Democratic Party tend to support certainly loosening the restrictions on cannabis out there. Members of the Republican Party have generally not been, and there's some exceptions on both sides. One very notable exception has been Governor Dayton.
Right.
So he, when we passed the medical cannabis program a few years ago, it is one of the most restrictive ones in the country. So a lot of people haven't been able to use it. It's limited to certain conditions. And it can only be ingested in certain ways. It can't be smoked. And I think, it's good taking a cautious approach, I think, to a level, but I think there's general consensus that, kind of just a prohibition type mentality over cannabis is not effective. So I think we need to start having some conversations about legalizing it for recreational use, and certainly limiting or making the medical cannabis program more accessible, because the way it functions now, it's so restrictive, it's also become very expensive, and there's a lot of people who aren't able to use it. So I think we need to have a lot of safeguards in place if there is a recreational cannabis program put in place. I don't want to see it become another tobacco industry where it's marketed towards kids. So they start experimenting with it at an early age. I'd like to see kind of a public health approach taken to it. So I actually introduced a bill last session that gives the Department of Health the authority to issue regulations relating to the sale and marketing of it. In most states, it's something like the Gambling Control Board or the Liquor Control Board, but I feel like the Department of Health would be able to do it with more of a public health focus. I think the age to purchase it needs to be 21. I think I think there have been disparities in the way the prohibition on cannabis has been imposed on certain groups. So I think we need to look at expungement of, if people have had nonviolent convictions for nonviolent offenses related to cannabis. I think there should be a process in place where those can get reviewed and possibly expunged from their record, especially if they're doing something that under the current system would be legal, but it was illegal when they did it. So I mean, there's a lot of people out there, and it's going to be a really complicated issue to deal with. It's going to probably, we talked about the committee process. It's probably going to have to go through every committee in the House. It touches on agriculture, on commerce, on health, on public safety. So it's probably not going to happen very quickly. Possibly not in the first year of the biennium. It might be something that's going to have to wait till the second year of the biennium.
Well, I want to thank you so much for taking your time and bringing your expertise and sharing it with our audience out there.
My pleasure.
And we'll ask people out there, if you've got questions or concerns and you live in 45B, be sure to contact Representative Freiberg. Bye.